Countless people around the world take magnesium, vitamin D3, and vitamin K2 not just to maintain their overall health, but to help fix some of the major health issues that have been troubling them for years. But here's the problem. Most people are doing it wrong. They take these supplements for months or even years without seeing any real noticeable improvement. No change in their sleep, their energy, their mood, or their blood pressure, and that's because they're missing how to take them properly and in the right combination. That's why in this video, we're going to do two very important things. First, we'll talk about 7 common health issues that can disappear, or at least significantly improve, when you start taking magnesium, D3, and K2 the right way. These are not just wild claims. There are countless scientific studies showing how these nutrients work together to resolve these problems naturally. And then, we'll go over how to actually take them properly, because the form, timing, and combinations really do matter if you want results. But before we get into it, please take a moment to hit the like button and subscribe to the channel. That helps this video reach more people who could truly benefit from it. Now, without further ado, let's get started. 1. Chronic fatigue and low energy. One of the most frustrating health issues people face today is chronic fatigue. That feeling of being completely drained no matter how many hours of sleep you get. What many don't realize is that this kind of relentless tiredness is often linked to deficiencies in magnesium, vitamin D3, and vitamin K2. Let's start with magnesium. This mineral is absolutely essential for energy production because it activates something called ATP, which is basically the fuel your cells run on. Without enough magnesium, your body can't efficiently turn food into usable energy. There's even research from the Journal of the American College of Nutrition showing that magnesium deficiency increases how much oxygen your body needs just to perform basic physical tasks, which is one reason you feel exhausted even after minimal effort. Now, vitamin D3 also plays a crucial role here. It doesn't just support your immune system, it's actually deeply involved in how your mitochondria function. Several studies, including one published in the Journal of Clinical Endocrinology and Metabolism, found that people with low vitamin D levels often suffer from unexplained muscle fatigue and low stamina. So if you're tired all the time, it might not be about sleep. It could be about how well your cells are producing and using energy. Then there's vitamin K2. While it doesn't directly boost energy the way magnesium and D3 do, it plays a supporting role by improving circulation and cardiovascular health. Better blood flow means more oxygen and nutrients are reaching your muscles and organs, which naturally helps sustain your energy levels. K2 also activates proteins that protect your cells from oxidative stress, helping your mitochondria function more efficiently over time. So when you're low in one or all of these nutrients, it's like trying to run a car with a weak battery and dirty fuel. You're just not going to feel right no matter how much you sleep. But when you get your levels up and take these nutrients the right way, many people start noticing a real shift in their energy, sometimes in just a few weeks. High blood pressure is one of the most common and silent killers today. What many people don't realize is that a significant percentage of those who develop high blood pressure actually do so due to long-standing nutritional deficiencies. And among the most critical of those are magnesium, vitamin D3, and vitamin K2. When these nutrients are lacking, your blood vessels can become stiff, inflamed, and narrow over time, making it harder for blood to flow freely. This forces your heart to pump harder, and over time your blood pressure rises. But studies have consistently shown that when people restore these deficiencies, blood pressure often begins to improve, sometimes dramatically. For example, a large meta-analysis published in Hypertension found that magnesium supplementation led to an average reduction of 4.2 mmHg in systolic and 2.3 mmHg in diastolic blood pressure, especially in people who had high blood pressure to begin with. Another study showed that vitamin D3 supplementation reduced systolic blood pressure by an average of 5 mmHg in people with low vitamin D levels. And although vitamin K2's effect is more indirect, its ability to prevent arterial calcification plays a major role in helping the arteries stay flexible, which is crucial for maintaining healthy blood pressure. It's also worth noting that potassium is another key player in this equation. Potassium helps your body get rid of excess sodium and eases tension in the blood vessel walls. The problem is, most people today get far too little potassium and way too much sodium, which throws off the balance. By increasing potassium-rich foods like leafy greens, avocados, bananas, and sweet potatoes, alongside proper magnesium, D3, and K2 intake, you can create the perfect internal environment for healthier blood pressure. So if you've been struggling with high blood pressure and nothing seems to work, it might not be just genetics or stress. It could be that your body is missing the foundational nutrients it needs to function properly. When you correct that, your blood vessels finally get a chance to relax and heal, and that's when real changes start to happen. Heart palpitations, that sudden flutter, racing, or irregular thump in your chest, can be incredibly alarming, even if you're told they're harmless. But what most people don't hear is that a surprising number of these episodes are actually triggered by nutritional deficiencies, especially in magnesium, vitamin D3, and vitamin K2. Your heart is an electrical organ. Every beat is controlled by finely tuned electrical signals that depend heavily on minerals like magnesium and potassium to fire correctly and consistently. When magnesium is low, those signals can misfire, causing skipped beats, extra beats, or racing rhythms, especially when you're stressed, dehydrated, or haven't eaten properly. One study published in the journal Circulation found that low magnesium levels were significantly associated with a higher risk of arrhythmias, including atrial fibrillation. And in another clinical trial, magnesium supplementation helped reduce the frequency and intensity of palpitations in people who had low baseline levels. Vitamin D3 also plays a role here. Low D3 is linked to higher levels of inflammation and poor cardiovascular function, both of which increase the risk of irregular heartbeat. And when D3 is restored, it supports calcium balance and heart muscle performance, two things that are crucial for maintaining a steady rhythm. And let's not forget potassium. Even a mild deficiency can disrupt the heart's rhythm. That's why people on certain diuretics or low-carb diets who lose a lot of electrolytes often start noticing fluttering or skipped beats. Adding potassium-rich foods while ensuring proper magnesium and D3K2 intake can often make a dramatic difference. So if you've been experiencing strange heart rhythms or palpitations, and your doctor has ruled out serious structural issues, it's worth asking, are you truly getting enough of these essential nutrients? Because for many people, once these deficiencies are corrected, that constant awareness of their heartbeat starts to fade, and the rhythm finally settles down. 4. Frequent illness or weakened immunity. If you catch every cold that goes around, or if it feels like your immune system just isn't as strong as it used to be, it's very possible that nutritional deficiencies are to blame, especially in magnesium, vitamin D3, and vitamin K2. A lot of people associate a weak immune system with things like poor diet or lack of sleep, and those are definitely factors. But what often goes overlooked is how crucial these three nutrients are in keeping your immune system sharp, balanced, and responsive. Take vitamin D3, for example. It's not just a vitamin, it's more like a hormone that directly activates immune cells, including T cells and macrophages, which are responsible for hunting down viruses and bacteria. Low vitamin D levels are consistently linked to higher rates of respiratory infections, the flu, and even increased severity of COVID-19. One meta-analysis published in the BMJ found that regular vitamin D supplementation significantly reduced the risk of acute respiratory infections, especially in people who were already deficient. Magnesium, on the other hand, is essential for over 600 enzymatic reactions in the body, and a strong immune response is one of them. It helps regulate inflammation and supports the function of immune cells like natural killer cells and lymphocytes. What's interesting is that even if you're taking vitamin D, your body still needs magnesium to convert it into its active, usable form. Without magnesium, your D3 can sit in the bloodstream without being fully effective. 5. Anxiety and sleep issues. If you constantly feel anxious, on edge, or struggle to fall and stay asleep, even when you're physically tired, there's a strong chance your body is missing something essential. And no, it's not always about stress or screen time before bed. For many people, the real culprit is a deficiency in magnesium and vitamin D3. Let's start with anxiety. Magnesium plays a major role in calming the nervous system. It helps regulate neurotransmitters like GABA, which slows brain activity and promotes a sense of calm. When magnesium is low, your nervous system becomes overstimulated. You feel jumpy, restless, and your brain just won't shut off. Now, when it comes to sleep, magnesium also helps the body produce melatonin, your natural sleep hormone. Low levels of magnesium are linked to poor sleep quality, frequent waking during the night, and even insomnia. A study published in the Journal of Research in Medical Sciences found that magnesium supplementation significantly improved sleep duration, efficiency, and reduced nighttime waking, especially in older adults. Vitamin D3 also plays a surprising role here. Low D3 levels have been linked to both depression and disrupted sleep cycles. Your brain actually has vitamin D receptors in areas responsible for mood and sleep regulation. When D3 levels are low, it can throw off your circadian rhythm, making it harder to fall asleep at night and feel awake during the day. One study from Nutrients showed that people with adequate vitamin D slept longer and had better sleep quality compared to those who were deficient. 6. Bone loss and osteoporosis. Since we're talking about bones, you might be thinking, shouldn't calcium be the star of the show when it comes to preventing bone loss and osteoporosis? And while calcium is important, it's far from the full story. In fact, without the right balance of magnesium, vitamin D3, and vitamin K2, taking calcium alone might do more harm than good. Here's why. Calcium needs a delivery system. Vitamin D3 helps your body absorb calcium from food and supplements into the bloodstream, but that's only half the job. Once calcium is in your system, vitamin K2 is what directs it into your bones and teeth where it belongs, instead of letting it build up in arteries or soft tissues, which can actually increase your risk of heart disease and other problems. Now, magnesium is just as essential. Your bones store over half of the magnesium in your body, and this mineral plays a structural role in bone density. But even more critically, magnesium is required to activate vitamin D3. Without it, D3 can't do its job in helping calcium get absorbed. A deficiency in magnesium has been linked to lower bone mineral density and a higher risk of fractures, especially in older adults. Multiple studies have confirmed this. For instance, research published in Osteoporosis International found that higher intakes of magnesium were significantly associated with greater bone density in both men and women. 7. Migraines and frequent headaches. Migraines and frequent headaches can feel like your body's way of hitting the panic button, disrupting your day, your focus, and sometimes even your ability to function. And while medications can provide temporary relief, many people find themselves stuck in a frustrating cycle where the headaches just keep coming back. What often gets overlooked is the role of nutritional deficiencies, especially in magnesium, vitamin D3, and K2, in triggering and sustaining these episodes. When your body doesn't have enough magnesium, your brain becomes more sensitive to stimuli that wouldn't normally cause pain. Blood vessels in the brain may spasm or become inflamed more easily, triggering that intense throbbing or pressure. Several studies have shown that magnesium deficiency is common in people with recurring migraines, and that supplementing with magnesium can significantly reduce both the frequency and severity of attacks. Low vitamin D3 levels are also linked to increased inflammation and heightened pain sensitivity. Your nervous system needs adequate D3 to help regulate inflammatory pathways and maintain healthy brain function. Now that we've talked about the incredible benefits of magnesium, vitamin D3, and K2, let's briefly go over how to take them the right way, because timing, dosage, and form really do make a difference. First, the recommended daily allowance, RDA, for magnesium is around 300 milligrams per day for women and 400 milligrams for men. If you don't have a specific issue like heart problems, neurological concerns, or constipation, a good all-around choice is magnesium glycinate. It's well absorbed, gentle on the stomach, and has calming effects. Here's how you can break it up. You can take 200 milligrams of magnesium glycinate in the morning, together with your vitamin D3 and K2. Be sure to take them with a breakfast that contains healthy fats like avocado, eggs, or olive oil to help with proper absorption, especially for the fat-soluble vitamins D and K. A few hours later, you can add your zinc supplement somewhere between 15 to 30 milligrams, ideally in the form of zinc glycinate or zinc gluconate. But if you're taking the higher end of that range, like 30 milligrams of zinc daily, you'll want to make sure you're also getting around 2 milligrams of copper to avoid developing a deficiency. That's important because zinc and copper work together, and both are involved in how your body activates and utilizes magnesium effectively. Then in the evening, you can take the remaining 200 milligrams of magnesium glycinate. This is perfect for helping your body wind down and get into a calm, relaxed state for a deep, restful sleep. Now, if your health goals are more specific, you can choose your magnesium forms accordingly. For brain-related issues like brain fog, poor focus, or anxiety, consider adding magnesium L-threonate to your routine. It's the only form shown to cross the blood-brain barrier and directly support cognitive function. If you deal with occasional constipation, you can take magnesium citrate as needed. It draws water into the intestines and supports regularity. For those managing blood sugar issues or heart conditions, magnesium taurate is an excellent option. It combines magnesium with taurine, which is particularly beneficial for the cardiovascular system. In all cases, though, try not to exceed 400 milligrams of elemental magnesium daily, unless advised otherwise by a healthcare provider. As for vitamin D3, newer research suggests that a maintenance dose between 2,000 to 5,000 IU daily is often necessary for optimal health. For people who are severely deficient or dealing with chronic conditions, therapeutic doses up to 10,000 IU may be used temporarily, but this should always be monitored by a professional. Now here's the key. When taking D3, it's important to balance it with vitamin K2. The recommended ratio is 10 mcg of K2 for every 1,000 IU of D3. So, if you're taking 5,000 IU of D3, aim for around 50 mcg of K2, ideally in the MK7 form, which has a longer half-life and supports calcium metabolism more effectively. Now, before adding any new supplement to your routine or making significant changes to your health plan, please consult your doctor or healthcare provider, especially if you have an existing condition or take medication. If you found this video helpful, please take a moment to like, share, and subscribe to the channel. It helps more people discover this kind of information, and you'll be the first to know when we post more practical, research-backed health content like this. Thanks for watching, and we'll see you in the next one.